This was Christmas Eve, '06. I was filling out my insurance forms, and the doctor came out the door and said, "Follow me." And I said, "Well, I haven't finished the forms yet." And he said, "They can wait. Follow me." I went into the back room, and he said, "That's it." And he went like this. "Half your brain is cancer." And the next thing I knew, I was here with Dr. Baskin.
So Matthew's case was extraordinarily interesting and challenging. Here's a bright young man managing a trust for his family, his whole life ahead of him, with a tumor right in the primary speech and language area of the brain. If we go in and take out too much, he'll never talk again.
When the ambulance pulled up at the hospital, they took me to intensive care unit. And that's when Dr. Baskin asked if I would be willing to join a special program. And I said, yes, I want to be part of the special program if that program can help me to survive. But not only that, but to help others to survive. And if what you learn from me can help even one other person in the world, I want to be part of this program. The morning of my surgery, my mom came in my room to wake me up to get ready to go to the hospital. And my dad was just behind her and standing in the door of my room. I wanted to compliment my mom and dad for my life, because I didn't know if I was going to be coming out of surgery alive or not. Dr. Baskin took 60% of my cancer out, left 40% in. He took part of my brain out so that my cancer had an area to heal.
So Matthew had a very specialized form of gene therapy with some interesting scientific wrinkles. We took a herpes virus and inactivated it and took the DNA of the herpes virus, put it inside a common cold virus. Why a common cold virus? Because it spread so quickly. So we took out the tumor that we could safely take out, and then we made 10 injections of this construct of the cold virus with the herpes DNA into the outside margins of the tumor. The cold virus, because it spread so quickly, spread through the rest of the tumor. Then we gave him a drug called Valtrex. Valtrex is a drug you take for cold sores, which is herpes. He didn't actually have active herpes in his brain, but he had that herpes DNA. So the cold virus drug went and killed the virus, which was spread through the tumor cells and therefore killed the tumor cells. And in his case, it truly was miraculous. He should be dead in 3 months. Here he is 7 years later, alive and well.
My experience as a patient in this hospital was incredible. If I wanted to ask a question about what was happening, they were more than willing to answer my question, encourage what we had to do, and I was more than willing to listen to them, and they were more than willing to listen to me. I also try to stay positive. To me, it's one of the most important things you can do. If you aren't positive, your chances go down.
Matthew was so anxious, his parents were so concerned, I was so concerned, and every step of the way I was very worried about him, very interested in his progress. We were in touch almost daily for many, many months to years later, but we have a wonderful result.
I feel incredible. I feel that I was blessed, and I feel like I was given the chance to help others. They gave me less than 3 months to live, January, February, March of '07, okay? May of '07, I was in England doing sheepdog trials with a friend of ours, which by all means shouldn't have happened. And here I am 7 years later, a miracle.